Well, tonight, more than 1 million people are enrolled in the state's Medicaid program, most of which is paid for by Uncle Sam. But Congress is considering cuts to Medicaid for all states over the next decade, which could leave South Carolina budget writers picking up the tab. Our Josie Frost is at the State House with the details.
The federal government covers around 70% of the costs of Medicaid in South Carolina. But under some proposed cuts from Congress, the state could be out billions of dollars in Medicaid funding, meaning lawmakers would be forced to find that money elsewhere or roll back on services.
In the past 3 years, after everything happened to me, to go from not being able to lift my head to being able to be at where I'm at now without my Medicaid services, I don't think I'd be where I am right now.
Samantha Humans has a disability and has been in a wheelchair for 3 years. She needs Medicaid to pay for services like her at-home caretaker.
I get services where she basically helps me with my daily ADLs. This is getting out to bed, getting ready in the morning, taking care of my hygiene, making sure I make it to my doctor's appointments, helping me with just basically anything to live quote unquote normal life as I can.
Medicaid covers around 1 in every 10 people with disabilities. It also covers half of all births in the state and more than half of all nursing home residents, according to the Kaiser Family Foundation. But proposed cuts has some fearing that landscape could change. Dave Anderson is an associate professor at USC's Arnold School of Public Health.
Different states will be exposed to Medicaid cuts very differently.
He says because South Carolina is one of 10 states that has not expanded Medicaid under the Affordable Care Act, some of the proposed spending cuts wouldn't have much impact at all. But Congress is also considering per capita spending caps. Instead of covering a percentage of all costs, the federal government would cover a fixed amount per person enrolled in Medicaid. A new study modeled different proposed per capita cuts and found that South Carolina would need to increase spending by at least $8 billion over a decade to maintain services.
I'd be extremely concerned about small rural hospitals and the safety net clinics. Those would be the first areas where we would see substantial impact. Medicaid is critical for rural hospitals to maintain, continue operations, keep their doors open.
Anderson says it's difficult to speculate right now exactly how these federal cuts could impact each state. And that's because right now we don't know what model Congress will use for the cuts. And he says if they do, it's possible that states will find other avenues to fund the program rather than reduce services. Reporting at State House, Josie Frost, News 19 WLTX.
All right, Josie, thank you so much.